In this video, we will discuss about tumor marker. Tumor, neoplasm or cancer, abnormal and uncontrolled growth of cells. Marker means the substance which are produced by tumor cell or normal cells. In response to tumor cell and detected in body fluid, there are known as tumor marker. The substance, especially protein molecules, which are produced by tumor cells or normal cells in response to tumor cells and detected in body fluid by various methods, they are known as tumor marker. They are associated with cancer. That's why they are called tumor marker. Next is samples, blood, urine, body fluids and tissues. Various tissues are taken for estimation of tumor marker. Next one is what are the characteristics for ideal marker? It should be constantly associated with disease. It should be specific for disease, especially cancer. Then it is sensitive to detect by various method is available. Then it should be present more concentration as compared to normal individual. Next, it should tell about the stages of disease, stages of cancer. That means extent of tumor, how long it is, extent of tumor, either local organ or extended organ. So it is tell about stages of diseases. So what are the characteristics of ideal marker? It constantly associated with the disease. That means specific for disease. Then it is sensitive to various method. Then it should be more concentration as compared to normal individual, and it should tell about stages of diseases. Next, what are the uses? First one, it is used for screening for disease. Screening, early detection of cancer. Early detection helps curing cancer. So it cure cancer. It is very important for pap smear. It is used for screening cervical cancer. Before symptoms appears, that is known as screening. It is used for screening cancer or disease. Second one is diagnosis. Diagnosis used for confirmation of the cancer along with the imaging technique. For example, CD scan, MRI scan, etc. along with the clinical symptoms. For example, alpha ketoprotein level, it is used for diagnosis of hepatocellular carcinoma. So, diagnosis used for confirmation of cancer along with the imaging technique. Third one is staging. Staging means extent of tumor, how long it is, whether it is invade local tissue or spread to distant part, that is metastasis. It's telling staging of cancer. Next one is prognosis, course of disease, whether patient will improve or whether patient worsen or it remains stable. That is known as prognosis. By using this one, we will know that patient condition. For example, embryonic antigen. It tells about this colon cancer. It tells about that prognosis of colon cancer. If more is the concentration, okay, that prognosis is worst. Here example, carcinoembryonic antigen, it tell about that colon cancer. If the concentration is increases in carcinoembryonic antigen, that prognosis is worst. Next one is monitoring. Monitoring of patient is treatment. In treatment, so therapeutic monitoring of tumor can be done with the help of tumor marker. So third one is staging. It tell about staging of cancer. Then prognosis, it tell about life of patient. Next one is monitoring. Therapeutic monitoring. Last one, follow up. Once the treatment is done, the regular checkup is done for the follow up of the patient, and the tumor marker helps follow up. So, tumor marker used for screening, diagnosis of disease, staging of cancer, prognosis of disease, monitoring of patient in treatment, and regular follow up of that patient. So, these are the use of tumor markers. So what are the uses? Screening, diagnosis of disease, staging of cancer, prognosis of disease, monitoring of the patient in treatment, and regular follow-up. These are the uses of tumor marker. Examples are classification of tumor marker. Tumor marker can be classified into oncofidal antigens, carcinoembryonic antigens, cancer or carbohydrate antigens, hormones, and various enzyme or other molecular marker. Coming to one by one discussion. First one is oncofidal antigen AFB, alpha fetoprotein. It include alpha fetoprotein. It is oncofetal antigens. It produced during the fetal life. Later on, the concentration of AFB, alpha fetoprotein, decreased. But whenever there is tumor or cancer of hepatocellular carcinoma, or whenever germ cell tumor, the concentration of alpha fetoprotein increases. So it can used for detection of hepatocellular carcinoma or germ cell tumor. So first example, oncofidal antigen AFB, alpha fetoprotein. It is used for detection of hepatocellular carcinoma or germ cell tumor. Second, oncofidal antigen, carcinoembryonic antigen. This antigen is useful in detection of colon cancer, lung cancer, and breast cancer. It is used for screening, diagnosis, staging, and prognosis of disease follow-up. Carcinoembryonic antigen used for reduction of colon cancer, lung cancer, and breast cancer. These two, that AFB, that means this alpha fetoprotein and carcinoembryonic antigen, these two are oncofidal antigen used for detection of cancer. Second one is carbohydrate or cancer antigen. Carbohydrate or cancer antigen CA 15.3 used for detection of breast cancer. Cancer antigen 19.9 used for detection of pancreatic or colon cancer. Then cancer antigen 125 used for detection of ovarian cancer. Next, hormones. First hormone ACTH. It is used for detection of lung cancer. Second one is beta HCG. This one used for human chorionic gonotrophic hormones used for detection of chorionic carcinoma. Choriocarcinoma used for reduction of choriocarcinoma. Then calcitonin used for screening of medullary carcinoma of thyroid gland. Third one is calcitonin used for screening medullary carcinoma of thyroid gland. These are the hormones. Then insulin used for detection of insulinoma. Then serotonin used for detection of carcinoid tumor. Then various catecholamine used for reduction of phenochromoscytoma. That means tumor in adrenal gland. Then last one is enzymes. Various enzymes used for reduction, monitoring, follow-up purpose. First one is ALP, alkaline phosphatase. It have two important variant. One is liver. Second one is bone. Liver, this one, it is helpful for reduction of liver metastasis. Then bone isoenzyme used for reduction of bone metastasis in bone cancer. Then NSE, neuron specific enolase, used for diagnosis of neuroblastoma. Then PAP, prostatic acid phosphatase, used for detection of prostate cancer. Then LDH, lactate dehydrogenase, LDH1, used for diagnosis of testicular and germ cell tumor. LDH4 and 5 used for diagnosis of liver tumor. Then HER2, human epidermal growth factor receptor 2, used for diagnosis of breast cancer. So these are the enzymes used for the tumor marker. This one is the statement form. Thanks for watching.